So without any delay, we have completed alcohols. Let me start sedatives and hypnotics. So CNS, sedatives and hypnotics. Now these are the important questions which are usually asked in the university exams from sedatives and hypnotics. Currently, let me teach you the difference between sedative and hypnotic. What is a sedative? What is the hypnotic? So sedative, hypnotic is the drug which produces sleep in the patient. Hypnotic, the word hypnos का meaning होता है sleep. In Greek language, it is used for treatment of insomnia. If the person is having difficulty in sleeping, if the person faces some difficulty in sleeping, we give hypnotics to them because these are the drugs which produces sleep in the brain. These are used on the treatment of insomnia. But hypnotics are these drugs. Sedatives are not these drugs. Sedatives are the drugs which makes the patient quiet, which make the patient thoughtless, which make the patient quiet, and which makes him drowsy without inducing sleep. These drugs don't induce sleep. Patient goes in sleep automatically. If your mind is quiet, you automatically go in sleep. If your mind become thoughtless, you don't think anything, your mind become empty, you automatically go in sleep, right? So these are the drugs which are not producing sleep. These are quietening the patient, the mind of the patient, so that he automatically goes in sleep, he feels drowsy, right? They calms down the patient, right? They reduces tension and anxiety in the patient. So these are sedatives. Give me a thumbs up if you got the basic difference between them, sedatives and hypnotics. That is our chapter. So before starting the chapter, you should understand the sleep cycle. I will teach you all sedatives. I will teach you all hypnotics, the classification, mechanism of action, uses, adverse effects, everything today. But first, let me teach you sleep cycle. So sleep is a cyclic process. Do you know that we all sleep daily, at least for 8 hours? The minimum good quality sleep is 8 hour continuous, 6 to 8 hour continuous sleep. So have you heard? My mother always say that sleep continuously for 6 to 8 hours. Don't sleep in installments, 2 hours, 2 hours, 1 hour. Don't do that. Take a continuous relaxing sleep for 8 hours in the night time. So that is a cyclic process, right? So in the sleep, if you take EEG while sleep, EEG is electroencephalogram, right? So you are taking EEG, you are recording the waves in the brain which are produced during the sleep. There are various types of brain: alpha waves, beta waves, theta waves, and delta waves. So these are the high and low amplitude waves which are having various frequencies. So don't learn the frequencies, but yeah, there are 4 types of waves along with K complexes. K complexes are there. Okay. Okay, give me a minute. So you see the cycle. Can you see this cycle? So this is the sleep cycle. Now let me understand. Let me help you in understanding the sleep cycle. After that, I will start the chapter. So in the sleep, we are having 5 stages. Stage 0, stage 1, stage 2, stage 3, and stage 4. So total, we are having 5 stages in sleep, right? Usual peoples, I'm not talking about you people. So I'm talking about usual people who sleep at 11 o'clock in the night. So usual people sleep 11 o'clock. 11 means 23, right? 23 p.m. That is 11 o'clock in the night. We should go to sleep. So whenever we sleep, first stage, our mind gradually goes in stage 0. Gradually, for few hours, for few half an hour, we are in stage 0, right? Then gradually our mind goes in stage 1. Can you see? That is, sleep is becoming deep. Sleep is, so whenever we are just closing our eyes, but we are not sleeping yet, we are just closing our eyes, we are in stage 0, right? Gradually the sleep is just coming, we are in transient stage, so it is stage 1. Gradually we go in stage 2, we go in stage 2, then we go in stage 3, and we go in deepest stage 4. So finally we go in stage 4, right? So these are the steps in the non-REM. There are 2 type of cycles, non-REM and REM. So this is your non-REM. Non-REM, these are the 5 stages. NREM, non-REM cycle. These are the 5 stages. So this is the cycle, the fifth stage, the last stage of the non-REM. Then gradually you come back. From stage 4, you come to 3, you come to 2, you come to 1, right? And then, can you see this one? What is this? This is your REM sleep. This is your REM. Then one cycle of non-REM is completed. Now one cycle of REM. Then again you will go in non-REM. Then again you will go in deep non-REM and come back from the non-REM. And then again you will go in REM. You will go in REM. You will go in REM. Then again you will go in non-REM. You will go in REM. You will go in non-REM. You will go in REM. You will go in non-REM. So can you see the cycles? In the first cycle, it is going till stage 4. In the next cycle, it is going at the junction of 3 and 4. In the next, it is going to 3. In the next, it is going to 2. In the next, it is going to 1. And see the timings. See the timing. You are sleeping at 11 o'clock. So in 1 hour, non-REM is completed till 12. From 12 to 1, you have REM. Then again from 1 to 2, you have non-REM. then again you have RAM, then you have non-RAM, then you have, so usually 40 minutes की cycle होती है, 40 minutes में you complete non-RAM, RAM, non, so there is alternate non-RAM and RAM. What we have learned from this pattern, we have two type of cycle, non-RAM, RAM. We have alternate non-RAM and RAM. In non-RAM, there are 4 stages. Stage 0, 1, 2, 3, 4. Total 5 stages are there. And alternately, we complete them, right? So morning 11 o'clock to morning, night 11 o'clock to morning 6 a.m. 6 a.m. in the morning, usual people get up. So this is the complete sleep. So in one sleep, how many cycles of non-RAM and RAM you are doing? You are doing 1, 2, 3, 4. Usually 4 to 5 cycles are completed. Each cycle contain one non-RAM and one RAM. Give me a thumbs up if you got the basics. Give me a thumbs up. So this is the summary. These are the basic, and in them there is alpha, beta, delta, theta, and K complexes are there. Everyone give me a thumbs up. Am I visible, audible? So what is your sleep cycle? If you know the basic sleep cycle, now it is easy for you to understand the effect of drugs, the various drugs which I am going to teach you today on the sleep cycle. In the sleep cycle, we have two type of sleep, non-RAM and RAM. And non-RAM and RAM are alternate. So first we start with non-RAM always. Then we go in RAM. Then we come in non-RAM, then we go in RAM. Then we go in non-RAM, then we go in RAM. So in non-RAM, there are stage 0, 1, 2, 3, 4. Stage 0, 1, 2, 3, 4. RAM do not have any further stages. 1, 2, 3, 4. Like this, we have various stages. So in non-RAM, RAM, there is alternate, and these are the various stages. And in one total 8 hours sleep, we complete 4 to 5 cycles. Each cycle contains nearly 40 to 45 minutes. Everyone give me a thumbs up if you got this. So this is the basic. Let me start the chapter. I'm not going in much detail. Let me start the chapter. The chapter is sedatives and hypnotics. Let me start sedatives and hypnotics. Everyone give me a thumbs up. In sedatives and hypnotics, I'm going to teach you three categories of the broad three categories of the drug. Today, I'm going to teach you all barbiturates first. I will start with barbiturates. There are three types of barbiturates: long acting, short acting, and ultra short acting. I will tell you the classification once I start the barbiturates. Then I will teach you benzodiazepines. Benzodiazepines are also of three types, but the classification, the way we classify is different. Some of the benzodiazepines are used as hypnotic for sleeping purpose. Some of the benzodiazepines are used as anti-anxiety. This is not for sleeping, just to calm down. Sometimes we feel very anxiety now. You know what is anxiety? From inside we have tachycardia, we are very thoughtful, we got tense, the tension, that is anxiety. So these are just calming down, not causing sleep. These are anti-anxiety. And some of the benzodiazepines are used for seizures, for epilepsy. These are known as anticonvulsants. So depending on their mechanism of action or various action, not mechanism of action, various uses, these are of three types. Barbiturates ka classification is depending on their duration of action. Some of them are long acting, some of them are short, some of them are ultra short. So the way we classify them is different. And some of them, the third category is non-benzodiazepines. These are also hypnotics and sedatives. So all Zolpi. So Zolpi clone, Zolpi dam, and Zolpidem. So three Zopi are there, Zopi and Zolpi. So this category I am also, others I'm not going to teach you. Others I'm not going to teach you. So I'm going to teach you three broad categories of the drug here. I will start with barbiturates, then I will come on benzodiazepines, and then I will come on newer. These are the newer drugs. Newer drugs, non-benzodiazepines. Everyone give me a thumbs up. Shall I start? Shall I start my chapter? This is the complete classification. Let me start with barbiturates. So let me start with barbiturates. Give me a thumbs up. Pratyaksha, Lavanya, Tej. Can you see me? Hear me? Everyone, those who are live, give me a thumbs up. I'm starting with barbiturates. So these are the headings under which I'm going to teach you all chapters of pharmacology, not only this chapter. In the introduction, I will tell you the definitions, important points about the barbiturates. Then I will teach you complete classification of barbiturate. The most important is mechanism of action of barbiturate. How barbiturate causes sleep. How barbiturate causes sleep. So I will teach you the mechanism of action. In brain, what are the receptors at which it is acting. Then the pharmacological action on other organs also, apart from brain. Interactions. Now, I'm going to teach you two main chapters. Now, what are the two main chapters? The first chapter is barbiturate and second chapter is benzodiazepine. उसके बाद newer भी पढ़ाऊंगी, small things about the newer, but benzodiazepines are superior and barbiturates are inferior. Nowadays, we don't prefer barbiturates. We prefer benzodiazepines. So tell me the reasons. Tell me 10 reasons why benzodiazepines are superior than barbiturates. So I will tell you the reasons why benzodiazepines are superior as compared to barbiturates. I will tell you reasons. Then I will tell you the uses. For what diseases in which we use barbiturates. I will tell you the adverse effects And I will tell you the poisoning, which is very common. It is used for suicidal purpose. Many people use sleeping pills for suicide. These are the sleeping pills, now the best sleeping pills available in the market. So the mentality is that the layman think if I take one tablet, I get sleep. I get sleep. If I take 100 tablets, I will get death. So that is the mentality for the person. That's why it is used for sleeping pill. So if poisoning is occurring and relatives are bringing the patient to you, what treatment you will offer? What are the symptoms and treatment you will offer? So these are the headings under which I'm going to teach you barbiturates also, benzodiazepines also. So I request you to make two columns here. One for barbiturates. First, let me finish barbiturates under these headings, and then I will teach you benzodiazepines under the same headings. Give me a big, big, big thumbs up. Should I start? Let me start with the first chapter, barbiturates. Barbiturates, right? Barbiturates are known as barbiturates because these are constituted. These are the substituted derivatives of barbituric acid. What is barbituric acid? It is malonyl urea. It is barbituric acid. So these are the substitutes of barbituric acids. That's why known as barbiturates. That is the chemical formula. So in the introduction, nothing important is there. Classification. These are of three types: long acting, short acting, ultra short acting, based on their duration of action. We will read the name of the drugs under these. Long acting is only one phenobarbital. Phenobarbital, very, very acting. Short acting are two: butobarbital and pentobarbital. And ultra short is thiopenton. It is used as an anesthesia, right? And methohexitone. These are used as anesthesia. These are used as for anesthesia. These are not used for sedatives. These are used for anesthesia basically. So basically long acting is phenobarbital and short. So barbital is the suffix. It is phenobarbital, butobarbital and pentobarbital. So three barbitons are there. Apart from it, anesthesia ki bhi drugs hain, right? Should I start? Should I move ahead? Okay, let me go ahead. Mechanism of action. The most important and difficult thing to understand here is the mechanism of action, right? Okay, in the brain, we have two types of receptors. GABA. We have two type of neurochemicals in the brain. The two type of neurochemicals in the brain are GABA and glutamate. GABA, these are the neurotransmitters. GABA is an inhibitory neurotransmitter and glutamate is the excitatory neurotransmitter. Give me a thumbs up. Everyone give me a thumbs up. Everyone give me a thumbs up. One is inhibitory neurotransmitter, one is excitatory neurotransmitter. So if you got this, this is the basic. Now what you want to give barbiturate to the patient. What are barbiturates? Barbiturates are sleeping pills. Barbiturates, these are the sleeping pills. These are hypnotics. These are sedatives. They will induce sleep in the patient. So among the two chemicals, which you want to increase and which you want to decrease by giving barbiturate? Common sense. Barbiturate देख के तुम क्या करोगे? You want to increase GABA or decrease GABA? You want to increase glutamate or decrease glutamate? I'm asking to you. Lavanya, Sauvajya, Girchetya, Rapulo, Tej, Pratyaksha, anyone else who is watching me? I can't see the names of all persons. Anyone can tell me. What is my question? You got it. What does barbiturate will do? Barbiturate will increase GABA or decrease GABA? Barbiturate will increase glutamate or decrease glutamate. What does they do? Barbiturates want to cause the sedation in the brain. They want to cause the sedation in the brain. Sedation कराने के लिए you want to increase inhibitory or excitatory. You want to increase which you want to increase or decrease. So most of the persons have answered. Okay, you all are right. You want to increase the inhibitory neurotransmitter. You want to increase the inhibitory, and you want to decrease the excitatory. Yes, yes. Now keeping this in mind, I will take the mechanism of action further. So barbiturate will have multiple mechanism of action. The two most important, number one, it will cause increase. It will act as an agonist for GABA. So it will increase GABA and it will decrease the glutamate, right? It is the excitatory and inhibitory, then two types of neurotransmitters. Okay. Before coming the action of barbiturates, before teaching the action of barbiturates, let me teach you what does normally occurs in the brain. In the brain, how does normally GABA action takes place? Let me teach you that normally. Normally, we have two neurotransmitters, as I have told you. GABA is an inhibitory neurotransmitter. GABA is synthesized in the brain by an enzyme GAEL, glutamic acid decarboxylase, from which GABA is coming out. Can you see? This is a neuron. This is a neuron in the brain. Inside the neuron in the brain, this is GABA got synthesized. Can you see? This is GABA. Glutamate got converted to GABA with the help of this enzyme, glutamate acid decarboxylase. This enzyme converts glutamate to GABA. So GABA is coming out in the space here. This is the GABA. And these are the receptors of the GABA in the brain. Can you see? Okay. This is the brain. On the brain, these are the receptors of the GABA. These are the receptors. So GABA will act on these receptors and it is an inhibitory neurotransmitter. Give me a thumbs up. Give me a thumbs up. So GABA receptors are present. GABA receptors are present. The various types of GABA receptors are present. So see this cell. On this cell, the various types of GABA receptors are present. 2 alpha receptors, 2 beta, and 1 alpha, beta, and 1 gamma. So 2 alpha receptors are there, 2 beta. I will explain you. Don't worry. So these are the 2 alpha, 1 alpha, 2 alpha, 2 beta, 1 beta, 2 beta, and 1 gamma. So 5 receptors are present for the GABA. So this is GABA. It is coming here. It is coming here. So these are the 5 receptors of the GABA present on the cell. Everyone on the cell membrane on the cell. Everyone give me a thumbs up. So these are the things. These are the things you can understand. So GABA is coming out. It is acting on its receptor. Once it acts on the receptor, can you see in the center chloride channel is there? These are the 5 GABA receptors, 2 alpha, 2 beta, and 1 gamma. Total 5 receptors are there. Surrounding the 5 receptors in the center, can you see a chloride channel? Can you see a chloride channel? When GABA is coming and binding with all its receptor, alpha, beta, and gamma, so it increases, it opens the chloride channel. Once the chloride channel got opens, it increases the flow of chloride. So chloride will go inside. More and more chloride will go inside. More and more chloride will go inside. It causes hyperpolarization of the neuron. It is causing inhibition. That's why GABA is an inhibitory neuron. So this neuron got inhibited. This is how neuron got inhibited. Give me a thumbs up. This is the basic you should know. So what is happening actually, see the GABA is coming out in the space. It is synthesized. It is coming out in the space. After coming out, it is going to the neuron. On the neuron, there are 5 receptors of GABA. 1 alpha, 2 alpha, 1 beta, 2 beta, and 1 gamma. Total 5 receptors. So the GABA will act on its receptor. Because of this action, there is a chloride channel. It will open up. It will open up. Because the chloride channel will open, more and more chloride will go inside. Because the chloride will go inside, it will cause hyperpolarization of the neuron. That will cause inhibition of the neuron. Give me a thumbs up if you got it. If you got this basic, this is normal. If you got this basic, let me teach you the mechanism of action of barbiturates. Now you will get it. There are 3 mechanisms. I will teach you all 3. Let me come on the first mechanism. The first mechanism is known as GABA facilitatory action. Let me teach you what the barbiturates are doing. Okay. Barbiturate is a drug. You are giving a barbiturate to a patient. Imagine you are giving, just suppose I am a patient, I am having difficulty in sleep. I am coming to you, doctor, I can't sleep. The whole night I am just awaken. My mind cannot calm down and I cannot sleep. So I just see the clock. It is 1 o'clock, 2 o'clock, 3 o'clock, 4 o'clock, 5 o'clock. Oh my God, it's morning, 6 o'clock. Till now I am not sleeping. So the complete sleepless nights are there. Give me some tablets so that I can get relaxed. I can sleep. So you had given barbiturates to me. So in the night, the next night, before going to the bed at 10 o'clock, I have taken the barbiturate tablet. So barbiturate is going inside me. It got absorbed. It is going in the blood. Via blood, it is going to the brain, in the neurons. In the neurons, it is going to the GABA receptor. It is going to the GABA receptors. After going on the GABA receptors, it is increasing the affinity of the GABA receptor for GABA. Have you got it? What do you mean by the term affinity? Have you got it? Okay, let me show you. This is barbiturate tablet, which I have taken in mouth. I have taken a tablet of barbiturate. This is that tablet. So this tablet is going in my blood. From the blood, it is going in my brain. In the brain, it is going to my neuron. This is the tablet. This tablet is going on the neuron, acting on alpha, 1 alpha and 1 beta out of the 5. By acting on 1 alpha and 1 beta, alpha beta ka junction, acting on that, it increases the affinity of natural GABA. This is natural GABA present in the body. Normally, natural GABA coming in the body and binding, just a second, binding here. So natural GABA coming, binding here. So it opens the chloride channel just for a second. It is for 1 millisecond. 1 millisecond ke liye open ho raha hai. But now barbiturate you are giving, so it is increasing the affinity of natural GABA. So now the same natural GABA will come bind with the neuron. Instead of 1, it will open for 10 milliseconds. So chloride channel will open more, for more frequency, for more time. More and more chloride will go inside. More and more chloride will cause more and more inhibition. So inhibition is increased. So inhibition is increased, so person will get sleep. Person will get sleep because of more inhibition. Give me a thumbs up. So basically natural GABA का affinity बढ़ा रहा है ये. That's why known as GABA facilitatory action. GABA जो natural GABA है उसी को और facilitate कर रहा है. So barbiturate is actually increasing the affinity of natural GABA. It is not doing its action. जो GABA कर रहा है उसको ही बोल रहे हैं हाँ तू अच्छा कर रहा है तू और you are doing a good job. You are doing inhibition. You are opening the chloride channel for 1 millisecond. Okay, I will help you to open the same chloride channel. Instead of 1 second, I will help you for opening it 10 seconds. So the same job is exaggerated. So the natural GABA, what it is doing, the same job of the natural GABA got exaggerated if you give the barbiturate. Give me a thumbs up. Give me a thumbs up. I tried to get it simplified. If you read directly KDT, everything will be bouncer for you. But now you will get it. So if you give a tablet of barbiturate, it will go on the GABA receptor. It will increase the affinity of natural GABA for the GABA receptor. So it increases the lifetime of chloride channel opening. Instead of, for example, 1 millisecond, it is opening for 10 milliseconds. It is not the exact time. Just for example, I am telling you. It is increasing the lifetime for chloride channel, right? It increases the more chloride. Flow of more chloride. More chloride, more hyperpolarization. More hyperpolarization, more inhibition. More inhibition means it will induce sleep. Everyone give me a thumbs up. Have you got it? Pratyaksha, Lavanya, Saujanya. Have you got it? Everyone give me a thumbs up. Should I proceed? That is the first action. That is GABA facilitatory action because it is facilitating means helping GABA. Helping the natural GABA to its job. To do its job more. Right? गाबा पहले क्लोराइड चैनल को खोल रहा था 1 सेकंड के लिए 1 मिली सेकंड के लिए अब बार्बिचुरेट गाबा को बोलेगा तू 1 के लिए नहीं मैं तुझे हेल्प करूंगा तो 1 की जगह 5 या 10 के लिए खोलेगा तो मोर क्लोराइड विल कम मोर हाइपरपोलराइजेशन मोर इनहिबिशन सो दैट विल कॉज स्लीप तो नेचुरल वाला ही ये हो रहा है action is exaggerated. The second thing is GABA mimicking action, not facilitating. It is mimicking. So at high concentration, if you give the barbiturate, the same barbiturate, at high concentration, it will directly go to the GABA receptor and it itself will open the chloride. Barbiturate is not asking GABA to open the chloride channel. Barbiturate itself is opening the chloride. GABA को बोलेगा अरे तेरे से नहीं हो रहा तू हट मैं खोलता हूँ. So the barbiturate, this is the barbiturate tablet now. So this barbiturate is doing two jobs. First, it is asking the GABA to do its job more exaggeratedly, helping the GABA to do its job more exaggeratedly. That is GABA facilitatory action. Second, it is itself directly opening the chloride channel. Directly opening the chloride channel, that is GABA mimicking action. It is mimicking the GABA for its action. This is GABA mimicry action. It is not facilitating GABA to do its job. It is mimicking GABA. It is saying, okay, instead of you, now I will open the channel. So it is increasing the flow. No, it is increasing the flow of, again, more chloride will go, more hyperpolarization, more inhibition, more sleep. Give me a thumbs up. So what are the two actions? GABA facilitatory, GABA mimicry. Have you got the two actions of the barbiturate? GABA facilitatory action and GABA mimicry action. Everyone give me a thumbs up. In GABA facilitatory action, the barbiturate will increase the affinity of natural GABA to increase the chloride channel opening. In GABA mimicry action, barbiturate himself will open the chloride channel. It will not ask GABA to open the chloride channel. Everyone get, so ultimately more and more chloride by both action. More chloride means more hyperpolarization. More hyperpolarization means more sleep. So ultimately it is causing inhibition, it is causing sleep. Everyone give me a thumbs up. Everyone. Ruchi, you got it? Very good, very good. So that, now let me come on the third and the last action. There are three actions now. The third action is not about GABA. It is about glutamate. As I have told you, there are two neurotransmitters. What happened? Just a second. What is happening? Okay. Let me see. Is it clear to you? Am I still live? Let me confirm. Am I still live? I guess I am. Okay. So listen, there are two neurotransmitters. The first is excitatory neurotransmitter, that is GABA. I'm sorry. The first is the first is inhibitory neurotransmitter. Inhibitory neurotransmitter is GABA. It is GABA, as I have already told you, GABA. The second neurotransmitter is excitatory neurotransmitter. The name of excitatory neurotransmitter is glutamate. Now you are giving barbiturates. Barbiturates are the drug which induces sleep. If you want to induce sleep in a person, you have to increase inhibition. You have to increase GABA. And you have to reduce excitation. You have to reduce glutamate. Right? The first two actions of the barbiturate are about to increase GABA. About to increase the action of the GABA. One is GABA facilitatory action. One is GABA mimicry action. In both of them, the GABA is more. There is more GABA, so more chloride, more hyperpolarization, more inhibition. But the third action of the barbiturate is inhibition of glutamate. It is inhibition of the excitatory neurotransmitter. So this is the third action in front of you. Barbiturate inhibit glutamate induced depolarization. It is inhibiting glutamate by acting on AMPA receptor. AMPA receptors are the receptors of glutamate. So barbiturate is inhibiting AMPA receptor. It is inhibiting glutamate. It is inhibiting excitation. So again inducing sleep. Give me a thumbs up. So ultimately the summary is that barbiturates are sedatives. These are sedatives and hypnotics. They show mechanism of action by three actions. These are the three actions. The first is GABA, facilitatory action. The second is GABA, inhibitory action. And third is glutamate, glutamate, uh, glutamate inhibition. Right? No, sorry, inhibitory nahi hai, mimicry action. Give me a thumbs up. So what are the three actions? Who will summarize? GABA facilitatory action, in which barbiturate go to the GABA receptor. After going to the GABA receptor, it helps GABA. It increases the affinity of the GABA for the same receptor, the natural GABA, so that it increases the chloride channel for more time. Instead of 1 second, it is opening for 10 milliseconds. So more chloride, more hyperpolarization, more inhibition, more sleep. The second action is GABA mimicking action, in which the barbiturate again going to the GABA receptor. But after going to the GABA receptor, it is not increasing the affinity of natural GABA. It itself is opening the chloride channel. Instead of asking GABA for help, saying कि तू हट मैं खोलता हूँ. So it is itself increasing the chloride channel for more time. More chloride channel, more chloride, more hyperpolarization, more inhibition. The third, it is going to AMPA receptor. It is inhibiting to AMPA receptor, so it is inhibiting glutamate. So excitation is reduced. So here inhibition is increased, inhibition is increased, and excitation is reduced. Ultimately, it is leading as a sedative. It is working as a sedative. Everyone give me a thumbs up. This is the best and the simplest explanation in the world I can give you the mechanism of action of barbiturates. Okay, coming on the next heading. If you got it, coming on the next heading. What are the actions on CNS? Who will give the summary of the action of CNS? As I've told you, in brain, barbiturate is causing depression in the brain by three mechanisms: GABA facilitatory action, GABA mimicry action, and glutamate inhibition action. The three actions. So it is inhibiting all areas of the brain, but inside the brain, most sensitive area for barbiturate is RAS, reticulo activating system. RAS is very sensitive, so it got depressed very much. All the brain is depressed, but RAS सबसे ज़्यादा depressed होगा. So if you give the barbiturate in small dose, it will cause sedation. It will, if you give the barbiturate in high dose, instead of sedation, it will cause sleep. If you give in more high dose, it is causing anesthesia, right? If you give in more high dose, it will cause coma and death. So these are dangerous drugs. You ask the patient to take one tablet. Instead of one tablet, this patient is taking 2 tablets, 3 tablets, or 4 tablets. You can see the person can die gradually. Everyone, that's why these are not safe drugs. These are not. Whenever the person is depressed, he can commit suicide using barbiturates. Barbiturates are the most common drugs used for suicidal purpose in the market. So these are not given on medical store over the counter without prescription. If any doctor is giving prescription for a barbiturate with a seal, with a registration number, then only medical store person will give that drug to the patient. Otherwise, verbally, if you say give me a tablet of benzodiazepine, the medical store person will not give you. These are the instructions given to that, because person can use that for the suicidal purpose. Give me a thumbs up. So that is the thing. These are not safe drugs, right? They cause three things in the brain. Okay, they increase the sleep latency. They decrease the sleep latency. What do you mean by sleep latency? So I usually go to the bed at 11 o'clock every night. I usually, and within 10 minutes I go to sleep. I'm very tired till night, and till night I got very, very tired, and I feel sleepy after having my dinner, after having a walk. I go to the bed and I just got to sleep at 11:10 or 11:15. So my latency time, usually normal person's latency time is 15 minutes to 30 minutes. 15 minutes to 30 minutes, the person after going in bed, the person fall asleep. The person is sleeping. The person is falling asleep. So this time is known as latency time. कितनी देर बाद आपको बेड पे जाने के बाद कितनी देर बाद नींद आई, that time is known as latency time. So everyone wants this time should be less. So as soon as you go to bed, you just close your eyes and you fall asleep. So that is the best thing you can have in the world, right? So the barbiturates are the tablet which reduces your latency time, which reduces the patient's latency time to taken to fall asleep. It is shortened. So it is good thing. It is increasing the duration of the sleep, right? So normally the person is sleeping for 4 hour, 3 hour, 2 hour. If he takes a tablet of barbiturate, he can sleep for 8 hours, 9 hours, 10 hours, right? So duration of the sleep is increased, right? And sleep architecture is also disturbed, right? In the sleep architecture, RAM is decreased. RAM or stage 3, 4 of the non-RAM is decreased, and rest of them will increase. So we have a cyclic structure now. It starts from non-RAM, then RAM, then non-RAM, then RAM. I have told you initially also, it is cyclic. It is alternate. Every night it is alternate. In the non-RAM, it is 0, 1, 2, 3, 4, 0, 1, 2, 3, 4. There are no stages in RAM, as I have told you. So this is normal. If I'm taking no tablet, this is normal in my mind, and I'm sleeping continuously for 8 hours. So in the 8 hours, 4 to 5 times this cycle is repeated. One RAM, one non-RAM completes one cycle. This is one cycle, this is one. So total I complete 4 to 5 cycle in 8 hours, because for one cycle I require 45 minutes. In 145 minute, I will complete this. In the next 45 minute, I will complete this. So I will complete many cycles in one night. Sorry, not 45 minutes. I guess 1 hour 30 minutes. 1 hour 30 minutes for one cycle. You have to check exact time. So 4 to 5 cycles in one night. Give me a thumbs up. Anyways, this is normal. But if someone is taking a tablet of barbiturate, the RAM duration will decrease. And stage 3, 4 will decrease here. So stage 0, 1, 2 will increase. So that is the sleep architecture is disturbed. It is not normal. What is the disturbance? You got it. Give me a thumbs up. So that is the action on the brain. In the brain, what is the summary? It depresses CNS. It depresses complete CNS, but basically it depresses RAS. It depresses reticular activating system more as compared to complete remaining CNS. Okay. Three things are there because of depression of the RAS. Number one, sleep latency is reduced. Latency kam ho jayegi. Sleep duration will be increased. Duration will be increased. And sleep architecture is disturbed. You can give the details of all. Sleep latency reduced. So within 10 minutes, the person will get sleep after going to the bed. Duration is increased. So person will sleep for 8 to 10 hours. Duration is increased. Architecture is disturbed. So RAM will decrease, the duration of RAM, and stage 3, 4 of non-RAM will decrease. Everyone give me a thumbs up. That is the summary. Everyone means everyone give me a thumbs up. That is the action on CNS. You can see here. Okay. Okay, if you the sleep is arousable, still you can arouse the patient. The patient is sleeping, the person is sleeping after taking a tablet of barbiturate, and if you arouse the subject, the person will be arousable. He will get up from the sleep. If you shout the name of the person, I don't know, Ram, Sham, please get up, get up, get up. If you call him, usko hilaoge, so he will get up, but he will remain confused and unsteady if waken early. Before 8 to 10 hours, if you arouse the patient after taking a tablet of barbiturate, so he will remain confused. What is there? He will not get anything, right? Night awakenings are reduced. He will not get up in the night. He will sleep continuously for 8 to 10 hours. But hangover is there. Like alcohol, the next day the person feels dizzy, disorientation of the mood, unstable. So hangover is there. So these are not good tablets. After taking the tablet, the patient feels sleepy, and he sleeps for the next day also. And in the morning, he is not waking up at time. And after waking up, he is having hangover. Give me a thumbs up. Give me a thumbs up. Barbiturates impair learning, shorten memory and judgment. So memory भी उसका short होगा. So after taking a tablet of barbiturate, I took a tablet of barbiturate at 11 p.m. in the night. Right? I took a tablet of barbiturate and I got sleep at 12 p.m. At 12 p.m. So इस एक घंटे में क्या हुआ? I don't remember anything. The next morning, if you ask, I will not remember anything. So it impairs learning. It shorten memory and judgment. Right? It don't have any analgesic action. No pain reduction. Rather, it is having hyperalgesia. It increases pain. Right? It is having anticonvulsant property also. It reduces seizures. It increases seizures threshold and reduces interactions. Don't give barbiturate with other drugs which have microsomal enzymes, cytochrome P450 action. Because barbiturates, phenobarbital is a barbiturate now. All barbiturates are enzyme inducers. Cytochrome P450 inducers. Cytochrome P450 inducers. These are cytochrome P450 inducers. Give me a thumbs up. So don't give them with other drugs. So you know other enzyme cytochrome P450 inducers, I guess. The mnemonic is GPRS cell phone. You should know the list of these drugs which induces cytochrome P450. G for greaseprolol, P for phenytoin, R for rifampicin, S for smoking, C for carbamazepine, and P for phenobarbital, which is the most important barbiturate. Give me a thumbs up. Give me a thumbs up. Don't give barbiturate with other CNS depressants like alcohol, opioids. Person will feel more sleepy. Don't give barbiturate with sodium valproate. Don't give barbiturate with grisopulmin. So these are the interactions. These are the interactions. Just a second. Have you got it? Should I proceed ahead? Am I still live? Just a minute. Let me see. Give me a minute. Am I still live? Can you see me? Yeah, I guess it is working. I guess it is working. Okay. Okay, so coming on the users. So because of all these features, barbiturates are not used as a sedative and hypnotic. No, no, barbiturates, these are very dangerous. Sometimes instead of one tablet, if patient is taking 4 tablets, he will die. So I cannot afford that in my patient. I will not give barbiturate as a sedative और hypnotic in my patient. कभी भी उसका दिमाग सनक गया तो वो suicide कर लेगा. So or anyone else in the family can do the suicide. So I will not prescribe barbiturate as a sedative drug because better options are available. What are the better options? Benzodiazepine, my next chapter. Benzodiazepines are available. So I will give benzodiazepine, which are a safer drug for sedative and hypnotic. So why barbiturates are used nowadays? They are used for two purposes, epilepsy and anesthesia. Barbiturates are not used for sedative or hypnotic. No, no, they are not used. They are superseded by benzodiazepines. Nowadays, we use benzodiazepine for hypnotic and sedative and anxiety, not barbiturate. We use phenobarbital in epilepsy. We use thiopental in anesthesia. So only two barbiturates are used. Others are not used. No other barbiturate is used nowadays. These are of historical importance. Give me a thumbs up. Why? Because there are many adverse effects. The next day patient, and these are not good sedatives also. The next day patient is having hangover. So it is not a good sedative. No. I want to give a good sleep to the person and a fresh morning. After a good sleep, the refreshing morning. At 6 o'clock, 7 o'clock in the morning, the person get up with a refreshing sleep. Wow, I got a good sleep and now I'm energized, I'm refreshed. It is not the morning the person get up after taking barbiturate sleep. The person is having hangover the next morning. I can't do work, I'm feeling low energy. No, hangover should not be there. So quality of life should not be hampered after giving sedative or hypnotic. So that is the best drug you can give. So you can give benzodiazepines instead of barbiturate. Don't give barbiturate. So hangover is there, drowsiness is there, sleep architecture is disturbed, and sleep disturbance on withdrawal, right? Paradoxical excitement is there sometimes in aged patient. Depression की जगह excitement हो जाएगा. Respiratory depression is there. In high doses, respiratory depression can be there. Person can't do the respiration and can die. Give me a thumbs up. These are the adverse effects, right? These are the adverse effects can be there. Drug automatism can be there, right? What do you mean by drug automatism? What is this term used as? Drug automatism का मतलब क्या होता है? समझता है क्या? I have told you, if the person is taking tablet at 11 p.m. at night, barbiturate tablet, रात को उसने सोने के लिए ली, he is facing difficulty in sleeping, so the subject thought, I will take a tablet of barbiturate and I will get sleep. So after taking the tablet of barbiturate at 11 p.m., he is having memory loss. Memory loss means amnesia हो जाता है उसके बाद. Immediately after taking the tablet, once the tablet goes in the blood, the patient have amnesia. Person don't remember. So after having amnesia, he will think that I should take a tablet again. I have not taken. He forgot that I have taken a tablet. So he will take another tablet. After that, he will take another tablet. He will take more and more tablet because उसकी memory में ही नहीं है that I have already taken the tablet. He will have amnesia. Owing to amnesia, patient get confused and he take repeated doses of the same tablet. Give me a thumbs up and he can die. He can die because of high doses. He can die. So it is a very, very dangerous thing. Have you got it? Hypersensitivity can be there. Tolerance can be there. Rapid IV injection can cause serious collapse, right? Increased vitamin D metabolism can lead to osteomalacia. Increased vitamin K metabolism can lead to bleeding. These all are the adverse effects. You should know the adverse effect. The last thing which I should teach you here is barbiturate poisoning. Everyone give me a thumbs up. The poisoning of the barbiturate. If some subject, if some patient or any person take high dose of barbiturate, either accidentally उसने गलती से ले लिया, or for a suicide purpose or homicide, for whatever accident, suicide, homicide, he take too much of barbiturate, what will happen? Number one, he will get unconscious. So instead of one tablet, he took 10 tablet, he took 100 tablet, right? Accidentally or suicidal purpose or homicidal purpose, someone has given to do the murder or something. So unconscious, the person will get unconscious. After that, the person will have respiratory collapse, circulatory collapse, the person will go shock and the person will die. The person will die. There may be renal failure, GI bleed, pulmonary edema, and cardiac irregularities, arrhythmias can be. So the person can die, right? Now, if you want to save this person, just suppose a young boy is there. There is a young boy. Just a second. There is a young boy. The age of the boy is 15 years. 15 years. He is in 10th standard. He got the result today and he is failed in the result. Now he feel very shy for declaring his result to the parents, and he tried to commit suicide. He tried to commit suicide after declaration. It is very common incidence now. He tried to commit suicide. So how to commit suicide now? He is a child. He has thought that my mother or my father takes sleeping pill every day, right? He knows there is a sleeping pill at my home, right? So he has arranged that sleeping pill, and he thought instead of taking one tablet, I will take the all 10 tablets together. So he has taken 10 tablets of barbiturate. 10 tablets of barbiturate, and after taking the tablet, he got unconscious. He got unconscious. Parents arrived in the room. Parents arrived in the room, and they have seen that the child is unconscious. They got very panic. So in the panic, they took the child to you in a car, and the child is unconscious, and you are a doctor. Doctor, please save our child. Please save our child. So he, and the empty strip, they have already seen the empty strip is there in the room. So they got that our child tried to commit the suicide taking sleeping pills. So doctor, save our child. He has tried to commit suicide by taking sleeping pills, and this is the empty strip. You can see he has taken this tablet. This is the empty strip. You can see. So you have seen that the child has committed suicide. He has taken too much of barbiturate. So this is the scenario in front of you. It is an emergency. What treatment you will offer to this patient? Can anyone tell me what treatment you will offer to this patient? What treatment you will offer to this patient? So this is a typical case of barbiturate poisoning. Till now unconsciousness is there. You do not want death. So what treatment you will offer? The first thing, you should do a gastric lavage, or you induce vomiting, emesis. You induce vomiting, you do gastric lavage, or you do activated charcoal saline catheteric lavage. Give me a thumbs up. After that, secure airway, secure ABC, airway, breathing and circulation. Give IV fluid because the person is in collapse. The heart is not pumping. Give dopamine to increase the intrinsic pumping of the heart, to increase the pumping of the heart. So give dopamine, right? After that, you want to excrete the barbiturate out of the body, yes or no? So barbiturate is an acidic drug. To excrete the acidic drug, you want alkaline diuresis. So make the urine alkaline, so that he can excrete the barbiturate present in the blood. Yeah, definitely, Samir, dialysis can be there. If renal failure is there, dialysis is the last option. You can do the dialysis also. See, this is the child. He is having too much of barbiturate. He has already ingested, right? This is the GIT of the child. See, this is the mouth, this is the esophagus, this is the stomach, this is the intestine. This is the blood vessel of the child. This is the blood vessel. Now the drug barbiturate is present at two places. What are the two places? Either it is present in the stomach, it is not yet absorbed, stomach and intestine, or it is present, already absorbed and present in the blood, right? Now you want to decrease both concentration if you want to save the child. All these drugs is going in the brain and depressing the brain, depressing the respiratory center, and the child can die, right? So you want to decrease. So the drug which is present in the stomach and intestine, that can be reduced by emesis, number one. Emesis means vomiting. Induce vomiting in the child, number one. Or do the gastric lavage. You can do the gastric lavage, do the emesis or vomiting, right? And you can give the charcoal. Charcoal will absorb the drug and inhibit the drug absorption, further more absorption of the drug. You can do that. If you want to decrease the concentration of the drug which is already absorbed in the blood, right? So that can be reduced by two ways. Either hemodialysis, you take all the blood out, filter the blood, and again re-inject the same blood, right? You can do that. Number one, you can do that. Number two, you can excrete the drug in the urine by doing alkaline diuresis. This drug is acidic drug, so make the urine alkaline, so that acidic drugs are excreted in alkaline urine. Yes, forced alkaline diuresis, Samir. Very good. It is known as forced alkaline diuresis. Now everyone give me a thumbs up. If you can see me, if you can hear me. Let me confirm if I can see your chat. Just a second. If I can see your chat, give me a thumbs up. Everyone give me a thumbs up in the chat box. Everyone. Have you got it? Should I proceed ahead? So that is the treatment you should offer. That is the management, right? There is no specific antidote for barbiturate. There is no specific antidote for the barbiturate. I am done with barbiturate. Let me start the second chapter, benzodiazepines. Are you people there? Should I start with benzodiazepines? Give me a thumbs up if I start with benzodiazepines. You people are there. Barbiturates are done. The same headings I will teach you benzodiazepines. Okay, let me start benzodiazepines. So classification, mechanism of action, pharmacological action, pharmacokinetics. Why benzodiazepines are superior than barbiturates? Tell me 10 reasons. Tell me many reasons. Adverse effects. So that is the things I am going to teach you. Let me start with classification. Let me start. I have already taught you the classification of barbiturates. The classification of barbiturates is based on duration of action. Short acting, long acting, short acting, ultra short acting. You know the names. Benzodiazepines action classification is not based on duration of action. Its classification is based on its action, its uses. So they are used as hypnotic for causing sleep, for inducing sleep, right? For inducing sleep. Number one, they are used to reduce the anxiety, that is anti-anxiety, not for sleep, for reducing anxiety. And they are used for seizures, that is anticonvulsant. So based on their different action, now you can see one drug is common in all of them, diazepam. Diazepam is a hypnotic also, anti-anxiety also, anticonvulsant also. Okay. The other drugs are different. You can see the names. There are some overlap. Lorazepam yahan pe bhi hai, yahan pe bhi hai. You can see. Right. So the alprazolam yahan pe bhi hai, yahan pe bhi hai. So you can see there is some overlap. Some drugs are common here, there. But diazepam is a drug, you can see it is present in all three categories. So all are zepam. Zepam. Hypnotics are diazepam, flurazepam, nitrazepam, alprazolam, timazolam, triazolam. So all are zepam and zolam. Zepams, zepams, diazepam, flurazepam, nitrazepam, alprazolam, tipazimam or triazolam. So zepam and zolams are there. Anti-anxiety में again diazepam तो है ही. Diazepam का ही बड़ा भाई क्लोर डायजेपोक्साइड, ऑक्साजेपाम, लोराजेपाम, अल्प्राजोलम. गिव मी अ थम्स अप. एंटीकन्वल्सेंट में डायजेपाम, लोराजेपाम, क्लोनाजेपाम एंड क्लोबाजेपाम. So various zepams are there. So various zepams are there. I know zepams and zolams. So I know the classification is difficult, but anyhow you have to learn it. There is no escape. You have to learn it. Give me a thumbs up. So that is benzodiazepines. Benzodiazepines. We can classify this way. There is second classification also based on duration of action. Some of them are long acting, some of them are short acting. So you can classify that way also, right? So short acting का एक mnemonic है. Short acting का mnemonic है STOLE, STOLE. STOLE. S is short acting. T say triazolam, timazolam, oxazolam, lorazolam and estazolam. So these are short acting, others are long acting. Anyways, so after the classification, now you know the classification of both. You know the classification of barbiturates and you know the classification of benzodiazepine. Barbiturates are classified based on their duration of action into three categories: long acting, short acting and ultra short acting. I'm not saying the drugs inside them. You already know the drugs. You already know the drugs. Here only one drug, phenobarbital, are there. Here two drugs, here two drugs. Total 5 barbiturates are there in the world, right? Benzodiazepines are many. Benzodiazepines are classified based on their uses, not on duration of action. So some of them are used as sedatives for sleep. Some of them, sedatives and hypnotics, are used as anti-anxiety for reducing anxiety, and some of them are used as anticonvulsants for seizures, right? You know the various names of the drugs inside them. You have to learn. The second classification is based on duration of action also. It is only long acting and short acting. It is not ultra short. So some of them are short, so I have told you the both classifications. Everyone give me a thumbs up. After classification, let me come on mechanism of action of benzodiazepine. So benzodiazepines only have one mechanism of action. I've already told you mechanism of action of barbiturates. If you are attending the lecture from the beginning, you may be knowing. Give me a thumbs up if you know the three mechanism of action of barbiturates. What are the three mechanism of action of barbiturates? Pratyaksha, Lavanya, Arul, Samir, anyone? Swajanya, anyone? What are the three? So one is GABA, facilitatory action. One is GABA, mimicry action. And the third is glutamate. Glutamate, inhibitory action. Glutamate, inhibitory action. Give me a thumbs up. Give me a thumbs up. Yes, Samir. All of them ultimately increases. The first two increases the chloride opening. The third one inhibits the glutamate. Give me a thumbs up. So ultimately increasing the inhibition. Ultimately increasing the inhibition. Yes, you know that. Yes or no? I've already taught you the three mechanisms of action of barbiturates. On the contrary, benzodiazepine have only one mechanism of action, not the three. Not the three, only one mechanism of action, that is GABA facilitatory. That is GABA facilitatory. I have already taught you that action. So what it is doing, so it is having only one mechanism of action, that is GABA facilitatory. It is not having GABA mimicry action. It is not having action on glutamate. It is having only one action, GABA facilitatory action. Listen, if you take a tablet of benzodiazepine, if the subject is taking, the patient is taking a tablet of benzodiazepine, just suppose I am the subject, I am having difficulty in sleep. I am coming to you, doctor. I am having sleepless night. I can't sleep in the night. From many nights, I am not sleeping and my mind is very tense. I need relaxation. I need a good sleep. But whenever I am trying to go and sleep, I am unable to sleep. So give me some tablet. Everyone else in my home is sleeping. My husband is sleeping. My children are sleeping, but I am awakened. The whole night I am awakened. Give me some tablet. It is a very difficult disease. You know, the persons who are having, they go in depression. So give me some tablets so that I can sleep. You are prescribing benzodiazepine to me. So you ask me to take the tablet half hour or 1 hour before sleep, whenever I want to sleep. So I want to go in sleep at 11:30. So I'm taking the tablet at 11 p.m. in night, right? If I take the tablet will go in blood, absorbed from my stomach and intestine. It will go in my blood. From blood, it will go in my brain. In my brain, it will go on the neurons. On the neurons, it will go on the GABA receptor. It will go on the GABA receptor. You all know about the GABA receptor. I have described this receptor. On the GABA neuron, GABA receptor have five the different parts. So alpha, the two alpha are there, two beta are there, and one gamma is there, right? One alpha, one beta junction is this. One alpha is this, one beta is this, one gamma is this. So total two alpha, two beta, and one gamma. This is known as GABA receptor. So ultimately, this is the GABA receptor. Whenever you were giving barbiturate, where the barbiturate was acting, see, this is a tablet of barbiturate shown here. This is barbiturate. Barbiturate was acting on one alpha, one beta. One alpha and showing its GABA facilitatory action, GABA mimicry action, both actions. Give me a thumbs up, that is barbiturate. But now you are giving a tablet of benzodiazepine. You are not giving barbiturate. You are giving a tablet of benzodiazepine. So you are giving diazepam. You are giving, diazepam to aapka, yes, you are giving diazepam. Diazepam. Can you see? This is a diazepam. This is a diazepam. So where it is acting? Where it is acting? It is acting at the junction of alpha and gamma. So not at alpha beta junction. It is at alpha gamma. So what is my point to tell you here? Barbiturates and benzodiazepine both of them act on GABA receptor. But their site of action is different. GABA receptor पे कहाँ act करेंगे? So barbiturate act on alpha beta junction and benzodiazepine act on alpha gamma junction. That is my point to tell you for MCQ purpose. Give me a thumbs up if you got it. ये MCQ के लिए ये याद रखना है. It is visible in the diagram also. Clear cut visible है. See a tablet of barbiturate where it is acting alpha beta junction. See a tablet of diazepam, that is benzodiazepine. This is benzodiazepine. It is acting on alpha gamma junction. Give me a thumbs up. Give me a thumbs up. It is acting on alpha gamma junction as you got it. So it is acting on alpha and gamma junction. इस पे MCQ है. Ongoing. So the tablet is going on the brain, in the neurons, in the GABA receptor. Being specific, GABA पहले तो blood में जाएगा. From the blood it is going to the brain. In the brain it is going on the neuron. On the neuron it is going on the receptor. The name of the receptor is GABA receptor. On the GABA receptor it is going on the junction alpha gamma. On acting on this junction, what it will do? It will stimulate, it will increase the activity of natural GABA. This is natural GABA. Normally this natural GABA come, bind here on the receptor, on the beta, here on the receptor, and increases the chloride opening. Increases the chloride opening so that chloride comes inside. Once the chloride comes inside, there is hyperpolarization and it will lead to inhibition. And inhibition leads to sleep. This happens normally. So the diazepam, the benzodiazepine, increases the affinity of the natural GABA. So now what will happen? Initially, the natural GABA was coming and opening the chloride channel only for one time. But now, in presence of benzodiazepine, one time in 1 second. In 1 second, it was opening in one time only, right? Now, in presence of benzodiazepine, in 1 second, it is opening for 10 times. That is frequency of opening is increasing. Frequency, so more times it is opening. पहले वो एक ही बार खुल रहा था. Only one time it was opening, chloride was coming inside, it was closing. In 1 second, it was opening once. But now in the same 1 second, it is opening 10 times. So that more chloride is coming. More chloride coming, more hyperpolarization, more inhibition, more sleep. Give me a thumbs up. Give me a thumbs up. Have you got it? So it is GABA facilitatory action. It itself What do you mean by GABA facilitatory? Benzodiazepine itself is not opening the chloride. It is asking GABA to open more. It is asking GABA. It is asking GABA that you increases normally opening the chloride channel only for one time in 1 second. Now in my presence, you open the same chloride channel 10 times in the same 1 second. So basically, it is increasing the frequency of chloride channel opening, not the timing. Not the timing. Have you got it? Now there is a big difference. I have told you barbiturate. I have told you benzodiazepine. I have told you both. Barbiturate and benzodiazepine. Both have GABA facilitatory action. Both go to the GABA receptor. They also go to the GABA receptor. Here it go to alpha beta junction. It go to alpha gamma junction. Okay. Ultimately, they are going to GABA receptor. On the GABA receptor, barbiturate increases the duration of chloride channel opening. Duration of chloride channel opening. It is increasing the frequency of chloride channel opening. I hope you got it. The students जिनको समझना था उन्होंने समझ लिया. समझदार के लिए इशारा काफी है. I hope. Right. This one. Normally GABA was opening the chloride channel was for 1 millisecond. But in presence of barbiturate, it is opening for 10 milliseconds. That is, it is increasing the duration for the opening of chloride channel. So more chloride is coming, more hyperpolarization, more inhibition, and more sleep. Give me a thumbs up. Benzodiazepine increases the frequency of chloride channel opening, not the duration. Not the duration. It is still opening for 1 millisecond. But initially it is opening only one time in 1 second, once per second. But now it is opening 10 times in 1 second. So it is increasing this frequency. So ultimately again more chloride, more hyperpolarization, more inhibition. Ultimately chloride more hai. But here the chloride is more due to increased duration of opening of chloride channel. Here the chloride is more because of increased frequency of opening of the chloride channel. This is the best way I can give you, the best simplest form I can explain you. If you read all these things from Katzunk or KDT directly, it will be a bouncer for you. I guess it will be a bouncer. But now if you read it today, now it will be a cakewalk for you. You will get everything. Okay, you will get everything. Give me a thumbs up. Give me a thumbs up. Have you got it? Should I proceed ahead? Should I proceed? So, okay. So, benzodiazepines. So, benzodiazepines, once you take, just suppose I am the subject, I am taking a tablet of benzodiazepine by mouth, orally, it will go in my esophagus, it will go in my stomach and intestine, it will get absorbed, it will go in my blood, from blood it will go in my brain, it will go on my neuron, on neuron it will go on GABA receptor, it will go on alpha gamma junction. On alpha gamma junction, it will act and it will increase the affinity of natural GABA on GABA receptor. How it will increase the affinity? By increasing the frequency of chloride channel opening. It increases the frequency, not the duration, in contrast to barbiturate. This is GABA facilitatory action. So more chloride will enter, more hyperpolarization, more sleep, more inhibition, more sleep. Everyone give me a thumbs up. Have you got it? Samir, Lavanya, Sachin, Badu, everyone, you got it? Swajanya, yes? So this is the thing. This is the thing. So that is the difference, right? So benzodiazepines have only GABA facilitatory action but no GABA mimetic action. In contrast to barbiturate, they have both actions. GABA facilitatory also, GABA mimicry also. Here benzodiazepines themselves do not cause anything to chloride channel. They ask GABA to do that. Have you got it? Have you got it? Have you got it? So let me draw a diagram for you. This is a neuron. On this neuron, this is the GABA receptor. This is the GABA receptor, alpha, beta. This is alpha, this is gamma, and this is beta. So 2 alpha, 2 beta, gamma. This is the sequence. This is the sequence, right? So this is a neuron. This is a GABA receptor, right? Now you are giving barbiturate and you are giving benzodiazepine, one tablet. Barbiturate will go alpha beta junction, this junction. Benzodiazepine will go alpha gamma junction, this junction. This is the first thing you should learn. Okay, you got it. Both are going. And this is the natural GABA. Normally, if both of them are absent, this is the natural GABA. Natural GABA act on beta. It act on beta. Natural GABA on acting beta, it open chloride channel. This is the chloride channel. It simply open chloride channel. More chloride will go. Chloride will cause hyperpolarization and inhibition. Right. Now, barbiturate. Listen, barbiturate will do two things. Number one, it will increase the affinity of natural GABA to increase chloride channel, to increase the opening of the chloride channel, and itself also it will open the chloride channel. So it is having GABA facilitatory as well as GABA mimicry action. But benzodiazepine have only GABA facilitatory action. That is, it will increase the affinity of natural GABA only for opening of the chloride channel. It will itself will not open the chloride channel. So it is not having GABA mimicry action. I hope you got it. The next difference is that barbiturate increases the duration of opening of chloride channel. It increases the frequency of opening of chloride channel. This is the best version from my side to all the students. Have you got it? Okay, I guess you got it. So since benzodiazepine have only one action, that is facilitatory, no mimicry, and barbiturates have double action, facilitatory as well as mimicry. So which are safe? By common sense, you tell me which are safe. Which are safe? The one which is having only one action, facilitatory, or the one which is having double action? जिसको double action है, instead of sleep, here can be death or coma, or death can be there because of the double action. We want only one action, facilitatory. We do not want double action. So that's why benzodiazepines are safe, because they have only GABA facilitatory action, no GABA mimicry action. Barbiturates are not safe. They have double action, facilitatory as well as mimicry. Have you got it? Have you got it? Give me a thumbs up. Everyone give me a thumbs up. Let me teach you the function of three more drugs. After that, I will teach you three more drugs. Let me teach you the name of these three drugs. So I'm going to teach you bicuculin. I'm going to teach you flumazanil, and I'm going to teach you DMCM. Let me teach you the full form of DMCL. In तीनों का mechanism बता दी हूँ. These are the other drugs acting on the same receptor. In GABA receptor, I have taught you two drugs now. Till now, I have taught you benzodiazepine, where it is acting alpha beta junction. I have told you barbiturate, where it is acting diazepam or barbiturate, one and the same thing. It is acting on alpha gamma junction. Let me teach you three more drugs which act on the same receptor. So the first drug is a GABA antagonist, which is known as biscuculin. It is antagonist of GABA. GABA antagonist. Biscuculin is a GABA antagonist. These two drugs, barbiturate and benzodiazepine, these are GABA facilitatory. These are GABA agonist. ये GABA के एक्शन बढ़ा रहे हैं, GABA को facilitate कर रहे हैं, GABA के agonist हैं. But biscuculin is GABA antagonist. It blocks GABA. It is GABA antagonizing action. Give me a thumbs up. GABA antagonist biscuculin. It antagonizes benzodiazepine action. Basically, it is a non-competitive. It is a non-competitive antagonist of GABA. Give me a thumbs up. The competitive benzodiazepine antagonist is flumazanil. So flumazanil is also competitive. Both of them are antagonists. Biscuculin and flumazanil. This is non-competitive antagonist and this is competitive antagonist. But basically, these are antagonists of benzodiazepine. ये benzodiazepines के उल्टे हैं. They will cause insomnia. They will not induce sleep. They will cause insomnia. They will reduce GABA. They will reduce chloride opening. Less chloride will come. Less hyperpolarization. Less inhibition means excitation. Give me a thumbs up. Give me a thumbs up. And the third drug, DMCM. What is the full form of DMCM? Dimethoxymethyl carbomethoxy beta carbolin. So it is a difficult name, but DMCM. It is benzodiazepine inverse agonist. You know inverse agonist क्या होता है? Antagonist सिर्फ receptor को block करता है. Inverse agonist उसका उल्टा करता है. So GABA facilitatory की जगह GABA के उल्टा action करेगा, right? So that is the thing. That is the thing. There is one more toxin that is known as picrotoxin. Let me show you picrotoxin. यहाँ पे है क्या? Yes, this is picrotoxin. This is picrotoxin. Picrotoxin blocks chloride channel directly. ये GABA पे act नहीं करेगा. Directly chloride channel को ही block कर देगा. इस tube को, इस channel. So what is the summary? What is the summary? On a GABA receptor in the brain, we have a neuron. This is a neuron. On the neuron, we have a GABA receptor. On the GABA receptor, there are two alpha, there are two beta, and there is one gamma. So total is a pentamer. There are 5 different subunits in a GABA receptor. Now there are various drugs. One is barbiturate, one is benzodiazepine. These are the two main drugs, right? Others में मैं बताऊंगी. It is biscuculin, biscuculin. One was flumazanil. One is DMCM. You know the full form of DMCM, I guess. DMCM. And one is picrotoxin. Right? These are the drugs, important drugs acting on this receptor. Barbiturates and benzodiazepine, these are GABA agonists. These both are GABA agonists. They increases GABA activity. They increases by two mechanisms. Barbiturate increases GABA by GABA facilitatory as well as GABA mimicry action. But benzodiazepines do only GABA facilitatory action, but they ultimately both are GABA agonist. Give me a thumbs up. Now, the other way around. Biscoculin and flumazanil are GABA antagonist. These are benzodiazepine antagonist, GABA antagonist. So biscoculin is a non-competitive antagonist and flumazanil is a competitive antagonist, but basically these are antagonists. These are not agonist. DCCM is an inverse agonist. Inverse agonist. I guess you got the difference. So these are agonist, these are antagonist, this is inverse agonist. And picrotoxin directly inhibit the chloride channel. In the center there is a chloride channel ना, ultimately पूरी लड़ाई chloride channel की है. तो picrotoxin directly inhibits the chloride channel. It is a non-competitive inhibitor of chloride channel. So that's it. Give me a thumbs up. So I am done. So the main drugs are in front of you: GABA, buscoculin, picrotoxin, barbiturates, benzodiazepine, DCCM, flumazanil. Read their definition. Read their definitions. Everyone give me a thumbs up. Who is agonist? Who is antagonist? Who is inverse agonist? So you should have a look over them, and many MCQs are framed from this table. Now don't learn this table, understand the table from this diagram. Everyone give me a thumbs up. Everyone. So what are the actions of benzodiazepines? Who will tell me? Number one, sedation. Sedation means it induces sleep. Number two, sedation means not induce sleep. Hypnosis means it induces sleep. Sedation means it reduces anxiety. It reduces anxiety. Anxiety को भी anticonvulsant, it reduces seizures. So three actions basically three actions are there. It induces sleep, it decreases anxiety, it decreases seizure. Anticonvulsant. These are the three uses. Uh, there are other actions also. It is having analgesic action. It decreases pain. It is decreasing pain. It is like a painkiller. It not used as a painkiller, but in the body it decreases pain. It is an antidepressant also, a minute action, not a main action, but minute action. It is an antidepressant. It is a muscle relaxant property also. It is a neuromuscular blocker like muscle relaxant property bhi hai. But one bad thing is there: anterograde amnesia. Anterograde amnesia means after taking drug, person do not remember anything. I take the drug at 11 p.m. today. After that, क्या हुआ मेरी जिंदगी में मुझे नहीं पता. So I will wake up directly in the morning and I will not remember. Yeah, I have taken the tablet at 11 o'clock. I don't remember anything. So that is anterograde amnesia. ये problem यहाँ पे भी है. Give me a thumbs up. Now, tell me the advantages of benzodiazepine. Why? Yeah, like alcohol, Samir. Okay. What are the advantages of benzodiazepine which make it superior from barbiturates? What are the advantages? So it is having a flat dose response curve. So instead of one tablet, if the patient is taking 4 tablets or 10 tablets, the patient will not die. Okay, the patient will die if he take 100 tablets. So relatively flat curve. Relatively. In case of barbiturates, instead of one, if the patient takes 4, the patient will die. It do not have any action on respiration or CVS like barbiturate. Barbiturate depresses respiratory effect, depresses CVS effect. No action on other body systems. No disturbance, minute disturbance in the sleep architecture. Barbiturate was disturbing sleep. उसमें RAM कम हो रहा था. नॉन रैम में 3-4 कम हो रहा था, तो डीप स्लीप कम थी, स्लीप ज्यादा थी. बारबिचुरेट लेने के बाद, आफ्टर टेकिंग बारबिचुरेट टैबलेट, द पर्सन ड्यूरेशन ऑफ द स्लीप इंक्रीजेस, बट दैट स्लीप इज नॉट रिलैक्सिंग. That sleep is not deep sleep. That sleep is only superficial sleep because the cycle 3 and 4 is not coming and RAM is not coming. So the person is not going in the dreamy sleep, a good sleep, a deep sleep. No, it is only superficial. So the person is having hangover the next day. Give me a thumbs up. Give me a thumbs up. Yes, less enzyme inducing activity, or rather Sami, no enzyme inducing activity. It do not activate any microsomal cytochrome P450 enzyme like barbiturate. So it can be given with other drugs. Low abuse ability, right? After taking barbiturate, the person have abuse. He has dependency. He have to take it daily for the pleasurable effect, not for the sleep. But it is having low abuse. It is not having no, but yeah, lower, right? And it is having a specific antidote. Flumazanil is available. So if in case of poisoning, you can give flumazanil. वहाँ पे specific antidote नहीं था. You were doing hemodialysis, you were doing forced alkaline diuresis, you were giving alkaline sodium bicarbonate, but there was no specific antidote. Here specific antidote is available. So see the differences. The summary is in front of you. Barbiturates, benzodiazepines. Everyone give me a thumbs up. Barbiturates have facilitatory as well as mimicry both action, but benzodiazepines have only facilitatory action, no mimicry action. It increases the duration. ये पोटेशियम नहीं है, सॉरी, क्लोराइड है. क्लोराइड चैनल का ड्यूरेशन इंक्रीज करेगा, ये क्लोराइड चैनल की फ्रीक्वेंसी इंक्रीज करेगा. अल्टीमेटली बोथ आर इंक्रीजिंग क्लोराइड चैनल. More chloride, more hyperpolarization, more inhibition, right? Here the DRC is steep, that's why it is dangerous drug. Even a minute increase in dose can cause the death. Dangerous drug. Here it is flat, so it is safe drug. If the dose increases there, so it is not death. It is not death, right? Addiction is more here, it is less here, right? Addiction is more here, it is less here. Amnesia यहाँ पे इतना नहीं है, लेकिन यहाँ पे ज्यादा common है. Antidote is not available here, but yeah, specific antidote flumazanil is available here. Everyone give me a thumbs up. I tried harder. Uses, you already know the uses of benzodiazepine. It is used for anxiety, it is used for amnesia, it is used for epilepsy. It is used for epilepsy, it is used for pre-anesthesia. right? It is used for anesthesia before procedures, small procedures like endoscopy. It is used for a muscle relaxant also, because it is having muscle relaxant property also. It is used in tetanus also. It is used in acute alcohol withdrawal as a substitution therapy. Just in the last lecture I have told you what is substitution therapy. Alcohol is a sedative. You want the alcohol to leave. In chronic alcoholism, you want the person to do the abstinence of alcohol, but when the person is leaving alcohol, he's having withdrawal symptoms. So you are shifting from alcohol to benzodiazepines first as a substitution therapy, right? As a substitution therapy. And psychosomatic disorders. So there are many uses. So enumerate them. These are the uses, right? There is a big list of uses here. But if you remember, in barbiturates, we have only two uses: in epilepsy and in anesthesia. It is not, the barbiturates not used for anxiety, for insomnia. It is used for epilepsy and anesthesia only. It is used for anxiety also, insomnia also, epilepsy also, anesthesia also, endoscopy also, muscle relaxant also, tetanus, alcohol substitution therapy, psychomotor disorder. Give me a thumbs up. Adverse effects, tolerance, dependence, hangover यहाँ भी है but low, relatively low as compared to barbiturates. Tiredness, somnolence, headache, vertigo, ये सब minute side effects हैं. So we are done with benzodiazepines also. Everyone give me a thumbs up. The newer drugs, the Zolpi group, I'm not teaching you now, but you got my point. What are barbiturates? What are benzodiazepines? Right? You tell me the classification of both. You tell me the classification of both. The three classes. Here, long acting, short acting, ultra short acting. Here, the three classes are sedatives or hypnotics, anti anxiety, and anti-convulsants. Hypnotics, anti-anxiety, anti-convulsants. So that is the classification. I'm not saying the drugs inside them. Tell me the mechanism of action of both of them. So here having two action or three action: GABA facilitatory, GABA mimicry, or glutamate inhibition. Here only one action, GABA facilitatory, not three action, right? Okay, these are dangerous and these are safe, right? So you know the reason. Uses batao dono ke. Who will tell me the uses? Who will tell me the uses? Uses here and here, adverse effect here and there. So uses यहाँ पे सिर्फ दो ही use हैं. Number one, epilepsy, and number two, anesthesia. Here also we have epilepsy, use in anesthesia, but before that it is used as a sedative, it is used as a hypnotic, it is used for anxiety. Give me a thumbs up. Right? Apart from it, it is used in alcohol substitution therapy. It is used in psychomotor disorder. What are the adverse effects? Who will tell me the adverse effects? यहाँ पे adverse effects बहुत सारे थे. Respiratory depression, circulatory depression, many. यहाँ पे adverse effects ज़्यादा नहीं है. Tolerance, dependence, hangover both sides. Give me a thumbs up. Now, which are superior, which are inferior? Who will tell me which are superior, which are inferior? These one are inferior. There are many reasons to tell. And these one are superior. There are many reasons to tell. Yeah. The barbiturates do not have specific antidote. They do not have a specific antidote. But benzodiazepines have specific antidote. The name of the specific antidote, the competitive one, is flumazenil. Flumazenil. Everyone give me a thumbs up. I tried harder. So I would like to stop here. Thank you very much for being with me. I really